My name is Hashem El-Serag. I'm a physician scientist at Baylor College of Medicine. My current role there is I'm the chair of the Department of Medicine. My research interest has always been on the epidemiology and risk factors of liver cancer. And as far as CPRIT, I've been the fortunate director of the CAP Coordinating Center, as well as the recipient of a previous large grant from CPRIT to form the Texas Hepatocellular Carcinoma Consortium. Science has developed in many areas that no one person can really have the expertise necessary to conduct the complicated and complex research studies that are required to prevent, detect, and treat a complex cancer like liver cancer. Liver cancer is just an entity that results from probably genetic predisposition, environmental factors, behavioral factors like alcohol, sociodemographic factors like poverty, healthcare factors like detection of lesions using the right tests. There's no one person that can understand all of those things. So what happens in typical research, someone who's an expert in one area applies for a grant, gets funded for it, and they do this project, not focusing on the rest of the picture. Having a coordinating center and bringing those investigators in a win-win situation where they don't lose anything by collaborating is essential in addressing a complex disease in a complex way, in preserving resources. Resources are not infinite. You can't give the same person different grants to address multiple aspects of the problem. And reducing the time to discoveries. So that's where I think collaboration is important, particularly for complex diseases like liver cancer. So we're hoping with this consortium is we're going to form a bidirectional link between the science and the population, with the ultimate goal of reducing the burden of the disease in this state. This collaboration has been fantastic, and it's really one of a kind, and CPRIT has ventured to fund a collaboration to build this consortium. We started out, as you say, with 5 recruitment sites. We've expanded to get 3 more. So we have Baylor, Scott and White, and we have the Doctors Clinic Renaissance at McAllen. So we have 8 recruiting sites. We have recruited approximately 2,500 patients with cirrhosis. We've been following them for several years. And this cohort, which we refer to as the Texas Hepatocellular Carcinoma Consortium, has been the focus for several projects, both funded by CPRIT in this round of CAP, as well as the attention of the National Institutes of Health. We applied for this coordinating center with 3 main goals. The first one is to enhance the research related to liver cancer in Texas by providing connectivity as well as infrastructure for researchers in this area. And I'll come back to connectivity and infrastructure. But the second goal is to enhance the education for researchers, healthcare providers, and the public at large about risk factors, prevention, and treatment for this entity. And the third one, which is quite unique, is to engage policy makers in policy-related changes to address the burden of hepatocellular carcinoma in Texas. We've made quite a progress on all 3 goals. So on the enhancing the connectivity, essential to this coordinating center is a steering committee where it includes all the principal investigators who are funded by research grants from CPRIT to do hepatocellular carcinoma research. So we meet every month. We have a rotating schedule of presentations, and it's an opportunity for those investigators who otherwise may never meet each other to hear about each other's grants, and for the steering committee which has several members who are not on those grants, to identify areas for collaboration, areas for leveraging resources, and areas and gaps where the center can provide help in terms of analytic techniques, conceptual models, biosamples. So that's on the connectivity end. And we've had this running meeting now for several months, and it's been, I would say, a tremendous success. On the education, we have a scientific committee. We've convened top experts from around the world who know different aspects of this disease, and their charter is for them to provide us with guidance about what they think is the cutting edge issues, the crucial gaps, the missed opportunities, the techniques that we should be employing in our study of this disease. So we can take this feedback and translate it into guidance for CPRIT and guidance for our investigators. Educating the providers, we're embarking on an education project where we assemble talks, slides, mini reviews to disseminate through healthcare providers in the state of Texas. One thing that is really exciting, we have formed a clinical network. We've approached more than 20 lead physicians who lead medium to large size healthcare organizations in the state, from the Panhandle to Brownsville. And we've put them all as part of a clinical network committee under our coordinating center. And we've asked them about gaps and opportunities related to the prevention, detection, and treatment for this liver cancer. And they have described their own settings. And now we're ranking the priorities based on their needs, on what do they want us to do. So some of them need help in identification of risk factors. Others need help in tweaking their electronic medical records. Others need CMEs. And we're trying to reach a priority list that we embark on implementing the results of the research in a way that helps providers on the front line. We're convening an annual hepatocellular carcinoma Texas-based conference that we hope over time will become a national destination for researchers and clinicians who are interested in learning about this disease. Dr. Wang is the first person to join the CAP. We're very excited about her project. It's a Houston-based project. It's a community-based project. She is investigating screening risk factors for liver cancer, then screening for cirrhosis, which is the condition that leads to liver cancer. She's doing that in collaboration with the Hope Clinic, which is a community-based clinic. And she's using these findings to form an intervention that is both linguistically and ethnically compatible to address the high-risk groups, particularly in the Asian community in Houston. So what we've learned is if you mean to do things, you can actually form useful partnership with community clinics. That there's tremendous appetite for grassroots organizations to partner with scientific committees, and that there is a real opportunity to prevent liver cancer through quote unquote simple techniques, screening for hepatitis, telling people that there is a hepatitis treatment, giving them something in a language that they can understand. The project is still ongoing, but it looks quite promising. For the coordinating center, what's really important, and I think that's what in the core mission of the coordinating center, we don't have to replicate this work again under a different name. Now we have a way of how to partner with a community clinic. Now we have material that is translated into Mandarin Chinese. So for the next project, we don't have to apply for another $1 million to do the same work. Now we have that collective institutional memory that we have these instruments that we can take and give to someone else in a different city to apply, by that reducing the time and the cost of future intervention and applying best practices that we can learn from one investigator and disseminate them to the rest of the investigators in our network. At the very base of it, there are main risk factors for liver disease. These are hepatitis B, hepatitis C, heavy alcohol, and fatty liver related to obesity. These 4 risk factors work by damaging the liver and forming a condition called cirrhosis. After cirrhosis, liver cancer develops. In the state of Texas, Latinos are affected disproportionately with fatty liver and alcohol-related liver disease. They have a lot more cirrhosis and a lot more hepatocellular carcinoma. In fact, the state of Texas leads the nation in all of these conditions. These 2 new grants address the same problem using different angles. The one study funded for Dr. Thrift calls for genotyping, basically examining the entire genome of healthy individuals, individuals with these risk factors, individuals with cirrhosis, as well as those with hepatocellular carcinoma, focusing on Hispanics. The hypothesis is the reason Hispanics have more of all of these may be related to certain variations in their genes that render them more susceptible to that. Then comes Dr. Conwell's CAP-related grant. She is focusing on individual, societal, interpersonal, socioeconomic factors that may explain the differences in the risk factors, cirrhosis, and hepatocellular carcinoma among the different ethnic and racial groups, again, with emphasis on Hispanics. So the beauty about those 2 questions, and hence the center, is we will be able to leverage those 2 projects, both conceptually, getting genetic concepts with socio-demographic concepts, as well as logistically. Instead of each investigator going and recruiting 1,000 people that belong to a different area, we would hope that by getting the 2 investigators together, they would be recruiting the same people and getting information for their respective projects. So we're really, really excited about all the projects that were funded, but those 2 highlight how the CAP is funding projects that are quite relevant to the state of Texas, and how the coordinating center will be quite relevant in reducing cost and enhancing efficiency and expediting results, and hopefully translating that to our community here in Texas. And I can tell you, there is no other model like this. And fortunately for us, through CPRIT and through Texas Hepatocellular Carcinoma Consortium, and through just a couple of presentations that we have made, the name Texas Hepatocellular Carcinoma Consortium is becoming mentioned in national and international meetings. And it's becoming quite obvious that through collaborative work and visionary leadership, you can establish resources that help investigators from multiple disciplines to address complex questions. So I think this is truly a trailblazing endeavor that is paying off even in record time at this point in time.